Let's begin with the next topic right now, guys. That is gluteal region. Gluteal region is one of the most important topic, and it has been asked. The questions regarding the gluteal region has been asked in like many exams, many times. Whether it is the NEET PG exam or the AIMS exam, and nowadays it's like INICT, and then even the FMG exam. Gluteal region is very much important topic. So let us learn everything in detail over here. And nowadays in the exam, like last year 2020, they have been asking the questions based on the attachments to the femoral bone also. So even that also we'll try to cover. And not only that, followed by this, we are also going to learn about the structures passing through greater sciatic foramen and lesser sciatic foramen that is most commonly asked in the PG exams. Okay, so let's begin with that from the scratch and let's go to the higher topics here. Now, first of all, in the gluteal region, you'll be actually having gluteus maximus muscle, which is the largest muscle in our body. It is not longest, largest, I'm telling, size-wise. So, gluteus maximus. And then there will be gluteus medius and minimus. Whatever diagram that you are able to see on the screen here, actually there will be a gluteus maximus muscle covering almost all the structures. But that gluteus maximus muscle has been removed from here. So, from this diagram, you are not able to see the gluteus maximus muscle. It has been removed. Now, after removal of the gluteus maximus muscle, you are able to actually appreciate here the gluteus medius, this one here. And then there is gluteus minimus muscle here, sir, that you are able to appreciate here. So, this one is gluteus minimus muscle. And both of them, the gluteus medius and the minimus, are getting inserted onto the greater trochanter only. But whereas one will be on the anterior surface over there and another one will be on the posterior surface. So, gluteus medius and gluteus minimus, both of them are getting inserted onto the greater trochanter. And covering all these structures, there will be actually gluteus maximus muscle. So, we'll do one thing here. First, we'll discuss in detail about these three muscles first. We'll try to segregate our topic like, first we'll discuss these three muscles. In each and every point required and every detail, we'll learn about these three muscles. Then we'll discuss about other muscles in the gluteal region, guys. So, first, try to make a table in your books there. Let us learn about the gluteal region, all the muscles in the gluteal region and the important concepts related. Make a table with the three columns. In the very first column, we are going to write down the name of the muscle. In the second column, the nerve supplying to that muscle. And in the third column, we are going to write down the action of this muscle, guys. First thing, we are actually going to learn about the gluteus maximus muscle. And then we are going to learn about the gluteus medius muscle. And then the third one, that is gluteus minimus muscle, guys. So, gluteus maximus, gluteus medius and gluteus minimus muscle. These three muscles we are going to discuss first. And out of these three also, first let's have a clarity regarding maximus. Point number one, it is the largest muscle in our body, size-wise. By the way, which is the longest muscle? We have already discussed that. It is the sartorius muscle, which is the longest one. What is the nerve which is supplying to gluteus maximus muscle? Here, from the name itself, you can remember it will be gluteal nerve. Gluteus muscle, it is gluteal nerve, no doubt about that. But the problem here, where most of the students will be confused, whether it is superior gluteal nerve or inferior gluteal nerve, which nerve is actually supplying to gluteus maximus. So remember, inferior gluteal nerve is supplying to gluteus maximus muscle. Gluteus muscles are supplied by gluteal nerve. That's easy, guys. Remember, your concentration, your focus has to be on inferior. Inferior gluteal nerve is the one supplying to gluteus maximus muscle. Now, what is the action of this one? This muscle is the one which will be helping in extension at hip joint. It is the one which will be helping in extension at the hip joint. Now, for example, right now I am sitting here, and wherever you are sitting and listening to my lecture right now, might be you are also sitting there. In a sitting position, my dear friends, remember our hip joint will be actually flexed. It is flexed. Now, from this sitting position, if I am going to stand up, then what is going to happen? This hip joint will be actually extended, and that extension will be done by gluteus maximus muscle. So, just for the sake of remembering, I am giving you one example so that you can correlate and remember that one, guys. So, gluteus maximus is actually helping in standing up from a sitting position. So, from a sitting position, standing up, that muscle which is helping in doing that is gluteus maximus muscle. Now, once you are done with this one, let us go towards the medius and minimus. Gluteus medius and minimus, these two muscles are supplied by superior gluteal nerve. Again, it is gluteal nerve only, but this time it is superior gluteal nerve. And these two muscles I'm mainly concerned with. They are actually helping in abduction at hip joint. They're actually helping in mainly abduction at the hip joint. There are other functions also. I'm not concerned about that. I want all of you to please concentrate and remember about the abduction. There is like medial rotation also they'll be helping in, but mainly abduction at the hip joint. And not only abduction at the hip joint, they will also stabilize the pelvis while walking. These two muscles are gonna stabilize the pelvis while walking. So gluteus medius and minimus. They're not allowing the pelvis to fall on any of the either side, right or left side. So they are going to stabilize the pelvis while walking. So that is the reason why these two muscles are extremely important. And there is one beautiful clinical correlation also. I'll explain you that in detail within few minutes, guys. Now, before moving ahead, let us even learn about their root value. These two nerves, that is superior gluteal nerve and inferior gluteal nerve, they are originating from where? Even that is also a little bit easier only. Superior gluteal nerve will be originating from L4, L5 and S1. Whereas inferior gluteal nerve, you can just come like one segment below, one level below, that is L5, S1 and S2, that is inferior gluteal nerve. So, superior gluteal nerve will be originating from L4, L5 and S1, whereas inferior gluteal nerve will be originating from L5, S1 and S2, guys. Perfectly done. Now, let us discuss the clinical correlation of gluteus medius and minimus. These two muscles are extremely important, guys. So, let's have a clinical correlation between anatomy and orthopedics. Let's try to discuss this one here. Now, the diagram which is shown on the very left side here, that is about the normal gait, sir. So, first let's concentrate on the normal gait. Now, please don't look at the other diagrams and don't confuse yourself over here. First of all, look at the normal gait. Like a normal person like you and me, how are we gonna walk? Guys, for example, when the right foot is on the ground and we are actually lifting the left foot is in the air, or we can say the left foot is off the ground, then what is going to happen? Okay, I'll tell you a little bit slowly here, try to understand very carefully here. This is one of the most important thing where examiners are confusing the students there, guys. When I take the left foot off the ground, left side of the pelvis is not like well supported. Right foot is on the ground, left foot is off the ground. So left side of the pelvis is not well supported. Therefore, it will tend to drop. Left side of the pelvis will tend to drop because of the gravity. But are we falling while walking? No, we are not falling while walking. So therefore, what is happening in the normal people like you and me right now? So in the normal people like you and me, what is going to happen? Contralateral side, opposite side, that's extremely important. The opposite side, that is your contralateral side, the gluteus medius and minimus. On the opposite side, you have got gluteus medius and minimus. These two muscles will contract. Okay, I'm just writing the plus sign there. That will contract and actually help in abduction at the hip joint. That is the meaning of abduction over here. So those two will contract and they will not allow the pelvis on the other side to actually fall down. And that is the reason why I told you that they are going to stabilize the pelvis while walking. I repeat here once more so that you don't get confused. First, understand normal. Understanding normal gait is very much important. And then later on, abnormal gait, you'll easily be able to correlate them. For example, a person like you and me walking, right foot is on the ground, left foot is off the ground. Because the left foot is off the ground, left side of the pelvis will tend to fall down. But is it falling? No. Why? Opposite side, contralateral side, medius and minimus muscle will contract and it will be actually helping in abduction at the hip joint and the pelvis will be stable while walking. That is what is happening in the normal people. Now let us see the abnormality. Try to recall, guys. What is the nerve which is actually supplying to gluteus medius and minimus? Superior gluteal nerve. If suppose the superior gluteal nerve is gone, if it is injured, then what is going to happen? Gluteus medius and minimus are gone. Wow. So now let us try to understand what is going to happen now. Again, the same thing. Look at the second diagram now, the next diagram. Right foot is on the ground, left foot is off the ground. Right foot is on the ground there, the left foot is off the ground. Then what is going to happen? Now this time, the left side of the pelvis will actually drop. It will fall. And this time, on the another side, the gluteus medius and minimus muscle, they are not working. Okay, so I'll just write down here as minus. They are unable to contract and they are unable to do the abduction at the hip joint. They're paralyzed, they're not working. So therefore, the person lifts the left foot there, the left side of the pelvis will drop down. Now how the person will walk then? Okay, how is he going to walk? Because he is unable to do the abduction. Now, because the medius and minimus muscle is gone, that is not able to do the abduction, the person will take the help of upper half of the body. So therefore, that person is going to move this upper half of the body on the other side, so that the pelvis will be pulled up. I mean to say abduction of the pelvis will be done there. Because the medius and minimus are not acting there, that is why upper half of the body moving on the other side so that the pelvis will come up. And then he is going to clear the ground, guys. Further, he is going to walk. Is it okay? So therefore, because a person is lurching on one side and then walking, that's the reason why this gait is known as lurching gait. Oh my God, I hope the concept is crystal clear. Understanding? So what you have to understand here in the lurching gait, the side on which the pelvis is dropping, the side on which the pelvis is falling down, remember, not that side of the nerve, the opposite side, the contralateral side, superior gluteal nerve will be actually gone. And on the contralateral side, what is going to happen? The gluteus medius and minimus muscles are actually gone. That's extremely important. So if the pelvis is dropping towards the left side, then there will be right superior gluteal nerve injury. That is something extremely important to remember in the lurching gait. And I hope you have learned this in orthopedics. In this, the sign that is positive is Trendelenburg sign, which is positive, guys. Trendelenburg sign, which is positive here. So let's make a note of this one here. I hope the concept is extremely clear. So if there is an injury to superior gluteal nerve, I'm just using this sign for injury here. If there is an injury to superior gluteal nerve, then the sign which is positive here will be Trendelenburg sign positive. If the Trendelenburg sign is positive over there, then what is the nerve involved? If they ask you in the opposite manner, it is superior gluteal nerve. And what are the muscles involved? Medius and minimus. And what kind of gait it is actually representing? Remember, it is lurching gait. The person is actually walking by lurching his body on one side, sir. Lurching gait. So in that lurching gait, the Trendelenburg sign will be positive. The nerve involved, superior gluteal nerve, and the muscles involved will be medius and minimus. Hope the concept is like crystal clear here. That's the reason why I told you gluteal region is extremely important. And first, discuss about these three muscles in detail, their nerve supply, their action, and the clinical correlation. Everything is done. Now, once you are done with this one, then let us learn the other muscles and make this topic a little bit easier for you. Now, look at this diagram here. In this diagram, there will be a greater sciatic notch here. And via this greater sciatic notch, you are able to appreciate one muscle coming out here, guys. And this muscle will be piriformis muscle. That is piriformis muscle, guys. That's the muscle coming out through the greater sciatic foramen only. And we are going to discuss about that in detail when we discuss about the greater sciatic foramen and the structures passing from there. There we have got the importance of piriformis. So now don't worry about that. Now I hope you are able to appreciate one muscle coming from here. This is obturator internus muscle. Okay, this one here will be the obturator internus muscle. And then this muscle which is rectangle shaped over here, whenever you have like a rectangle shape, that is nothing but quadratus, and this is like quadrangular muscle, quadratus femoris muscle here, sir. So this one here will be the quadratus femoris muscle. You are able to clearly see their obturator internus muscle coming from that obturator foramen side, and then there is a rectangle shaped muscle, that is quadratus femoris muscle. Once you are able to identify these two muscles, then look more closer. Above and below the obturator internus, you are able to find above and below the obturator internus, you are able to find a muscle, and that muscle will be your gemellus. One will be the gemellus superior muscle, another one will be the gemellus inferior muscle. Gemellus superior and gemellus inferior muscle. So there are like four muscles which we are actually speaking about. If I tell you in order, first gemellus superior, then obturator internus, then gemellus inferior, then you'll be having that quadrangular muscle, that is quadratus femoris. Be careful, it is not quadriceps femoris, it is quadratus femoris. Okay, so these are also belonging to the gluteal region. Let us include in the same table here. So number one, you have got gemellus superior muscle, and just below the gemellus superior muscle, you have got obturator internus muscle. You've got the obturator internus muscle. And then below that, there will be gemellus inferior muscle. And then below that, there will be quadratus femoris muscle, guys. So gemellus superior, obturator internus, gemellus inferior, and quadratus femoris. Let's follow the same table. The next thing to write down is nerve supply. Now, nerve supply is so easy here that gemellus superior and obturator internus, these two are supplied by nerve to obturator internus. The name of the nerve itself is nerve to obturator internus. I think you people have learned upper limb along with me, like the videos of upper limb I think you have watched. In upper limb also there is a nerve supplying to latissimus dorsi, nerve to latissimus dorsi. There is a nerve supplying to subclavius muscle, nerve to subclavius. The name itself is like nerve to subclavius. So similarly here also gemellus superior as well as obturator internus, those two will be supplied by nerve to obturator internus. Gemellus inferior and quadratus femoris, these two will be supplied by nerve, and that nerve is nerve to quadratus femoris only. Wow. So the name of the nerves are quite easy there. Now the last and final thing, what will be the action? All these four muscles, remember, they are the one which are helping in lateral rotation at hip joint. So all these four muscles are helping in lateral rotation at the hip joint. So gemellus superior, obturator internus, gemellus inferior, and then quadratus femoris, all of them are helping in lateral rotation of hip joint. So this completes your entire gluteal region in a very easy and crystal clear manner, guys. I hope it's done. So all the muscles in the gluteal region are done. And not only that, guys, remember, not only all the muscles over here, we're even done with their nerve supply, their action, and one of the clinical correlation, that is Trendelenburg sign positive, which is seen in the lurching gait, and we have done that in an extremely crystal clear manner. Now let's move ahead. Now the next thing that we have to actually learn, if this is done, the next thing followed by that, what you have to learn is what are the structures which are going to pass through greater and lesser sciatic foramen. So let's learn that, guys. Let's go to the next topic right now. So continuing with this one, guys, the next thing that we have to learn is what are the structures which are going to pass through greater sciatic, lesser sciatic foramen. First of all, look at this beautiful diagram on the screen here. You're able to see your hip bone having that upper expanded part ilium, the part which is meeting in the front, pubis, and below will be your ischium. And in this, you are able to appreciate that there is one foramen here, and this foramen is actually referred to as greater sciatic foramen. And there is one more foramen over here, and this one is referred to as your lesser sciatic foramen. And we got to learn what are the structures which are going to pass through the greater and lesser sciatic foramen. But the problem here is that what I have observed during the live classes and all, students are mostly writing this entire structures passing through the greater and lesser sciatic foramen in the form of mnemonic, ABCD and all, trying to mug up. Please don't do that. Just hardly it will take half a minute of time. Stop yourself and try to understand first of all what is actually happening here. Where are we exactly? Where the structure is passing? So if you just try to analyze where are we exactly right now, of course you are able to see we are in the pelvic region here. This is nothing but the pelvis only. Okay. Now from the pelvic region, from the pelvis, there are certain structures which are going to pass through the greater sciatic foramen. Okay. And if they are going to pass through the greater sciatic foramen, try to understand in 3D, where are those structures actually going? From the pelvis region, where are they actually going? And I can clearly see in our diagram over here that from the pelvis region, the structures are going behind. And what do you have behind this one? Behind this, definitely there will be gluteal region there. That's the reason why I taught you about the gluteal region just now. That is the reason why I taught you actually about the gluteal region just now. So if the structures are going to pass to the gluteal region, now you yourself try to recall in your mind, what are the structures which are required in the gluteal region? Do we need a superior gluteal nerve? Of course. Do we need inferior gluteal nerve? Of course. Do we need nerve to obturator internus there? Yes. And nerve to quadratus femoris there? Yes. And already we have learned in the very beginning of the lower limb topic that even the sciatic nerve is going to pass through the gluteal region. Yes. So all these structures which we have just learned few minutes back in the gluteal region, which will be supplying to all those muscles in the gluteal region, guys, those nerves are required. And from where are those nerves coming? Those nerves are coming from the pelvic region only. Via which foramen? Via the greater sciatic foramen. This makes the things easier. Don't try to learn all these topics like randomly here and there. So follow all the topics in the same sequence in which I am teaching you. Out of experience, I am telling you guys, these things are going to make it easy for you to remember. Please don't worry and don't learn in that mnemonic form. Like how many mnemonics will you be remembering, like A, B, C, D every time? So try to form a concept behind that. Gluteal region is done. the structures required in the gluteal region, and they are coming from the pelvis and via the greater sciatic foramen. Just try to recall in your mind. You yourself will get the answers. Even I don't have to teach you right now. So let me show you like one more diagram here, guys. This is the diagram. And again, you can see, appreciate the greater sciatic foramen here. Beautiful. And what is that muscle which is going to pass through the greater sciatic foramen here? This is piriformis, which I have just now shown you in the gluteal region. Because of that piriformis, what is going to happen? There are certain structures which are going to pass above the piriformis, and there are certain structures going to pass below the piriformis. They are actually passing through greater sciatic foramen only, but it's like a little bit more headache for us. In greater sciatic foramen, we have to again divide them into above piriformis and below piriformis, structures passing through that one. Okay, so let's begin making the list here without mugging up in a conceptual manner. So structures passing through greater sciatic foramen first. Let's see what are the structures which are going to pass through the greater sciatic foramen. And in this, let us again divide them into two categories, above the piriformis and below the piriformis. So by this we can clearly say, definitely piriformis muscle is going to pass through greater sciatic foramen only. So piriformis muscle is going to pass through greater sciatic foramen. Based on that, we are dividing the structures into two categories, above and below the piriformis. Now what do you have above the piriformis? It makes sense. Superior gluteal nerve, artery, vein. So superior gluteal nerve, superior gluteal artery and vein, all of them are going to pass above the piriformis. Wow, it makes sense, and that's the only structures passing above the piriformis. Above, superior. Done. Now what are the structures which are going to pass below piriformis? Below piriformis. Whatever left out. So in the beginning, in the introduction, whatever I said you, all the structures you can just dump it here. I mean to say they're all passing below the piriformis, remaining everything. Come on, try to make a list here. Inferior gluteal nerve, artery and vein. Inferior gluteal nerve, artery, vein. And then along with that, nerve to obturator internus. And then along with that, nerve to quadratus femoris. And not only that, even the sciatic nerve. Even sciatic nerve is going to pass from below the piriformis only. And whenever you observe the diagram of those structures which are going to pass through greater sciatic foramen, along with the sciatic nerve on the medial side, there will be a thin nerve along with that one. And that is actually the posterior cutaneous nerve of thigh. So along with this sciatic nerve only on the medial side, you will be able to appreciate there will be posterior cutaneous nerve of the thigh. These two will be together passing. So above the piriformis, superior gluteal nerve and artery and vein. Easy to remember, above, superior, and everything is going to pass below the piriformis only. It's clear? Now once you are clear with this one, there are certain more structures which are going to pass through the greater sciatic foramen below piriformis. Let us just add them here, guys. That will be the pudendal nerve, and that pudendal nerve along with the internal pudendal artery and vein. So pudendal nerve along with the internal pudendal artery and vein. And even the nerve to obturator internus also, guys. Even there will be nerve to obturator internus. So nerve to obturator internus already we wrote there, but I'm just writing it again over here. Why? Because most of the time we will be learning this one as pin structures, PIN. So already I wrote there, guys, above, but I just want to write it again over here just to make that mnemonic which you will be learning from the first year onwards. Pin structures are going to pass from here. Pudendal nerve, internal pudendal artery and vein, and the nerve to obturator internus. But there is a beautiful concept here, I'll tell you, and there was even a question asked in the exam. How they are framing the question, just observe that, guys. First of all, where is this pudendal nerve beginning from? Pudendal nerve is going to originate from your S2, S3 and S4, guys. So let me just write down here as S2, S3 and S4. So from here, what is going to happen? The pudendal nerve is going to originate. Fine, absolutely fine. I'm happy with that. Now try to recall from the pelvis and perineum topic. Pudendal nerve actually has to go down into the perineum region. It is a content of your perineal pouches. So basically what, as a simple medical student, I am thinking here that after beginning from this S2, S3 and S4, the pudendal nerve should directly go here into the perineum region. But there is a problem. Pelvis above, perineum below, between them there will be a diaphragm, that is pelvic diaphragm. And these pin structures are not going to pierce through the diaphragm. No. They are not going to pierce through the pelvic diaphragm. I repeat again, above you have got your pelvis there, below there will be perineum, and between them there will be pelvic diaphragm separating the pelvis and perineum. And these pin structures are not going to pierce through the pelvic diaphragm. No, they are not going to pierce through that one. So what they will do, they will be first of all, like pudendal nerve. Pudendal nerve first of all will be going through greater sciatic foramen. Okay. And after passing through greater sciatic foramen, it is going to take a turn around that spine, that is nothing but ischial spine, and then it is going to come into the perineum region via that lesser sciatic foramen. Beautiful. So if you just imagine this one to be the ischial spine there, ischial spine, then what is going to happen? The pudendal nerve is going to first go through greater sciatic foramen, then take a turn and come via lesser sciatic foramen. And not only the pudendal nerve, along with that even the artery and vein, guys. Internal pudendal artery is also going to go, take a turn and come via lesser sciatic foramen. And even the internal pudendal vein is also going to pass through and take a turn and come via lesser sciatic foramen. So the pin structures are going through the greater sciatic foramen, taking a turn and coming via lesser sciatic foramen. The moment you learn this concept or learn it in a very conceptual manner, guys, it's so simple. We have already written this in the structures passing through greater sciatic foramen. Perfectly done. And now if I ask you, what are the structures going to pass through lesser sciatic foramen right now? I don't even have to teach you and you don't have to learn, guys. Why? Because the same pin structures are going to take a turn and come via lesser sciatic foramen also. So you can just repeat that. That's why I'm telling you, don't try to learn with that mnemonic and all. Try to make a concept. So next topic, what are the structures passing through lesser sciatic foramen? The structures which are going to pass through the lesser sciatic foramen will be your pudendal nerve, and along with the pudendal nerve there will be internal pudendal artery and vein, that is internal pudendal vessels, guys. And along with that you even add there will be obturator internus tendon. So just now I have shown you in the diagram, guys, there will be obturator internus muscle and its tendon is the one which is going to pass through the lesser sciatic foramen. So along with the pudendal nerve and the vessels, there will be obturator internus tendon passing from there. So you can remember like this, what is the muscle which is going to pass through the greater sciatic foramen? Piriformis. And similarly, there is one muscle whose tendon is going to pass through lesser sciatic foramen, that is obturator internus tendon is passing from here, sir. So this is how we can make the topic which is like structures passing through greater and lesser sciatic foramen very much easy. All those structures we can learn it easily once you have learned about the gluteal region. So follow in the same order, learn the gluteal region, then you learn about these structures passing. I hope this is making some sense over here, guys. Okay, so that's all. This completes the topic here. Done.